Hello everyone, I'm Dr. Devika Chopra. I'm a consulting obstetrician and gynecologist practicing out of my own clinic, Hope Clinic at Tarde. So the first ultrasound that usually we prescribe for is around the 6th to 7th week, just to confirm the location of the pregnancy, to confirm the heartbeat of the baby, and to see that there is no delay in conception. Sometimes what happens is that your period date doesn't correspond with the growth of the fetus. That can cause a lag in the sonographies for around 1 to 2 weeks. And so we can misinterpret this later on in pregnancy and think that the baby is not growing well. So the first sonography that we prescribe during pregnancy is the 6th to 7th week viability scan. It also tells us the location of the pregnancy. The next most important scan, which is done at the 11th to 12th week, which is the NT and NB scan. That is the nuchal translucency and the nasal bone. So what it checks is the translucency of the skin, the pad of fat that is there below the neck, and also checks whether the ossification of the nasal bone has taken place. These two things are really important to know whether the baby is genetically normal or no, and these are soft tissue markers for genetically abnormal babies. At around 18 to 20 weeks, then we undertake another sonography, which is called the anomaly scan. I usually tell my patients that this scan is essential. It tells us whether the baby's physical status, that the physical structure of the baby is normal. The eyes are fine, there's no cleft lip, cleft palate, the hands have 5 fingers each, the feet are normal, there's no problem in the stomach. So it tells us the structure of the baby is normal. There are also certain soft tissue markers that can be seen in these scans, which tell us whether the baby is having any genetic abnormality or not. The next scan, most consultants do not prescribe it in low resource settings, but I send it to all my patients, is the echocardiography. That is the fetal 2D echo, which is done around 22 to 24 weeks. It tells us whether the structure of the fetal heart is normal or no. There is no VSD, ASD or any other major cardiac malformation with which the pregnancy cannot continue. The next sonography is around 28 to 30 weeks, which is the interval growth scan. That scan tells us the growth of the baby is normal, the fluid around the baby is normal, and if needed, we need to add something in the patient's diet or no. Because many times the baby's weight lags behind and we need to add certain protein supplements in your diet. The next sonography is undertaken at around close to delivery, that is around the 34 to 36 week, which we actually again see the growth of the baby, and we do a Doppler study. The Doppler tells us whether the blood flow in the fetus is normal, and also if any intervention needs to be taken at that time, whether we need to deliver the baby or certain steroids have to be given, then this scan is really important. So these are all the sonographies that are undertaken during pregnancy. In many low resource settings, only 3 sonographies are done. That is the 11-week scan, the NT-NB scan, the anomaly scan, which is around 18 to 20 weeks, and the growth scan, which is around the 30 weeks. These are the most essential scans that need to be done. The other scans are just something that we add in high-risk pregnancies.